here. Yeah. So my name is Eleni Prifti, and I'm here to talk to you about the role of environmental health in lifestyle medicine. So I am an environmental chemist, and I just completed the ELMO certificate myself. So what is environmental health? Environmental health is the branch of public health that is concerned with all aspects of the natural and built environment affecting human health. So what we study in this field is anything that has to do with our environment, like noise pollution, like chemical pollution, even the viruses like coronavirus. So epidemiology is a branch of environmental health. Here I'm just showing you two very good books that represent the field. So today I'm going to focus at the part of environmental health that studies the exposure to environmental toxic chemicals. Where do these toxic chemicals from? I'm going to start now. So we have three spheres that give that they are the source of toxic chemicals in our bodies. The first sphere is our house sphere. So whatever we have in the house, like our furniture, our detergent, the things that we put in our skin, our diet, could be a source of toxic chemicals that come from the environment. The other sphere that you probably see here is the technosphere. So our urban and industrial ways, lives, are a source of certain chemical pollutants. So most of them are toxic to humans. And then we have the biggest sphere, which is external, which is our ecosphere. If you see here, almost half of this sphere, you see the land where we actually grow our food. And then half of it is our seas, where we get also food. So we use our seas for the fisheries of them. So you can see that our food systems actually are probably the main source of our exposure to environmental toxic chemicals. These molecules, these substances, can affect almost any part of our body. We have studies to show that, but there are 5 different systems that are mostly affected by environmental chemicals. So we have the nervous system, which is affected by chemicals which are called neurotoxicants. We have the immune system, which is also affected by those chemicals. And we have, for example, the rise of autoimmune diseases that could be correlated to environmental toxic chemicals. Then we have the respiratory system that is exposed to toxic chemicals through the air pollution. And we have the reproductive system, which is also a system that is affected very much by toxic chemicals. So we have, like, for example, unexplained infertility, or early labors, early births, or miscarriages. These are conditions that have been very strongly associated with environmental chemicals. And lastly, the system which is probably affected the most is our endocrine system. So we have a huge variety of chemicals, a huge category, which are called endocrine disrupting chemicals. You can find them with the EDC initials at the literature. And those chemicals affect our hormonal balance. So they actually affect everything. how much is the problem? How big is the problem? So you can see here that the problem of chemical pollution is like an iceberg. What does this mean? Right now, we have about 100,000 chemicals on the market. And the thing with chemicals is like, it's not like pharmaceuticals, like the drugs that we actually first try somehow and then we release. With most chemicals, we produce them and we ask questions later, which is really, really not safe. Till now, it has been proved. So out of these 100,000 chemicals, 70,000 chemicals are with very poor characterization for their hazards and their exposures. The 20,000 of them are with limited characterization for their hazards. The 10,000 of them, so 1/10 about, is fairly well, but yeah, not very well, but fairly well characterized. And we have almost 500 chemicals out of the 100,000 of chemicals that are extensively characterized for their hazards and exposures. So who is, what category of people are the most vulnerable to these chemicals? I'm sorry. Yeah. So the category of people which is most vulnerable are kids. Actually, fetuses, infants, and toddlers up to about 2 years old. Why does this happen? We know today that during this period of life, I mean, from the first moment of conception and for about 1,000 days of our life, we have the most epigenetic alternations to our genetic material. So the mutations that will happen at that critical point of our life will determine the health of our body later on. Will be determinant factors anyway. So this period, it's called critical epigenetic window. This concept is called developmental origin of health and disease. You can find it with these initials. And exactly because nowadays we know how important this is, we have a new branch of pediatrics. So I don't know if we have any pediatrician at the group, but if we do, this is definitely something that you would be interested to check. Environmental pediatrics is the combination of a pediatric science with environmental toxicology, actually. So what have we said till now? We have said that these chemicals, these toxic chemicals, come from almost anywhere, okay? They affect almost anybody or any body system, and they mostly affect our kids. So what can we do? I mean, if we have 100 factors that affect our exposure, how can we limit 100 factors? We can't. So in environmental sciences, we always depend on cost-benefit analysis and on risk assessment and management. What we always try to do, if we have even an ecosystem that we want to study, we cannot study all the pollutants which are there. So we try to estimate which are the determinant factors, which is the factor that I can work on. And if I work on that, I will get some improvement. So the main pathways of environmental toxicants are three. It's our skin, it's our lungs, and it's our mouth. Whatever we put on our skin, either it's personal care products like the makeup, the shampoos, the body lotions we use, or the things that we use at our house as detergents, like the bleach that we use, are a very important pathway of environmental toxicants. Then we have what we breathe. Air pollution is also a very important pathway. and that goes for both outdoors and indoors air pollution. But it's diet, which the science, scientific the evidence show that it's diet, that it's the most important, I mean, the determinant factor of most of those environmental toxicants. Let me explain that. Why? Why is diet so important? So here we will see two terms that probably medical doctors are not familiar with them, but they are two terms which are very important in environmental sciences. It's the term of bioaccumulation, I'm sorry, and biomagnification. What happens with most of those toxicants is that they are lipophile. So they can accumulate in the fat tissue of living organisms. Exactly because these organisms, like animals and humans, we cannot get rid of them very easily. We cannot change them biochemically. So you can see here that the source of pollution, which is this black plant here, whatever chemicals we have from whatever source of pollution we have in our environment, they will end up either at the land, either at the sea. It's actually here, I should have also put another arrow from the land to the sea, because we know today that whatever chemicals we produce on the land, they actually end up at the sea at some point. And from these environments, the animals can pick up these toxicants. Let's say, I'm going to use the example of heavy metals, maybe because most of people have heard them. So if we have a concentration of heavy metal, let's say mercury, in the sea, as we go up to the food chain, these concentrations are getting bigger. And that happens exactly because as we go up to the food levels, every animal actually consumes smaller animals, and since smaller animals and these ones, they cannot get rid of the environmental toxicants, they accumulate them in their tissues, in the fat tissue. That is why as we go up at the food chain, humans have a risk of getting higher concentration of environmental toxicants depending on what diet they have. So if you see here, these ladies, the pregnant lady and the non-pregnant lady that I am showing, they eat an animal-based diet. Okay, so they get the concentrations which are in the risk, middle area risk, or if they eat big fish, fish that are very high in the food chain, so they can be in a higher risk also. But if those humans were mostly eating plant-based food, then we would know that their concentration exposure, the toxicant exposure would be less. Unfortunately, and that is very important for the environmental pediatrics that I said earlier, the breastfeeding babies are at the higher level of food chain because they consume the milk which is produced by their mothers. So studies show that especially when it comes to dioxins, for example, the breastfeeding babies could be exposed to extremely high amounts of toxic chemicals. So how we can reduce this exposure from the three main pathways that we just said? When it comes to what we put on our skin, it's very important that we choose personal care products that are confirmed not to contain toxic chemicals. So nowadays we have platforms and we also have applications that you can take a picture from a product, let's say a body lotion, take a picture of the ingredients, and the application actually tells you whether or not you have confirmed toxic chemicals in this product. So you don't need to go, you know, one by one. You don't need to be a chemist. You just have to know where to search. Also, when it comes to cleaning products in our house, we can do the same, but there it also makes a huge difference if we reduce the number of used products. So we have to try to use as less products, cleaning detergents and chemical products as possible in our house, like use eco-friendly cleaning methods. When it has to do with the air pollution, unfortunately, we cannot avoid air pollution when it's outdoors. So, for example, if somebody is living in a city of India, the air pollution he will be exposed will be really big. So there you cannot really do. I mean, it needs to be a policy change. But we can take significant steps to reduce the air pollution in our house. Air pollution in our house mostly comes from our furniture, from the poor ventilation, from cleaning material, the cleaning chemicals, as I said earlier, from our mattresses. So if you are aware that you have to take steps, you can inform, get the education that you need online. You can find these steps easily available to reduce the exposure of toxic chemicals in your house. And then the third and most important, as I said earlier, is to eat more plants. Eat mostly plants. And why do plants help us when it comes to the exposure to environmental toxicants? I already said, because firstly, they have lower concentrations. But another very important way they help us is because we know today that plants are already designed to have some ability to reduce the bioavailability of those chemicals. So when it comes, for example, to heavy metals, I'm using this example, the plants have big molecules, phytonutrients, that can chelate. Chelate is actually a word that we use for chemical bonding. They can bond to many of the heavy metals, and they can reduce the toxic effects that they have in our bodies. So, as I said, when it comes to the diet, we have to eat more plants, but you will see that here ELMO actually advocates for a diet which is a Mediterranean-based diet. And it means that we do choose to eat animal food products also. So the question here is that if we follow a Mediterranean diet plan, how much animal-based food should we eat? What kind of animal-based food should we eat? And whether we should personalize these choices according to whether we are pregnant or we are young or we are elder. So what I want to say is that we have to apply this cost-benefit analysis that I said earlier to dietary guidelines. Let's see the costs. I'm going to say cost and then benefits. Let's see the cost. So unfortunately, when it comes to the consumption of fish, today we know that the overall use of fish and shellfish stocks in Europe is beyond the limits of long-term sustainability. In simple words, that means that our fish is finishing. All over the globe, that is a known problem. And in some specific areas, like in Mediterranean area, we have today the 60% of fish stocks are overfished to biologically not sustainable levels. And that is data of European Union of 2020, so it's very new. The second risk, the second cost of animal-based food consumption is the fact that animal agriculture inland, it's actually one of the main drivers of pollution and the deterioration of natural ecosystems on lands and seas. As we saw in the beginning, we have a lot of chemical pollution coming from the animal agriculture, and it doesn't only affect our air quality, it affects our soil pollution and our seas pollution. We also know that overconsumption of certain animal-based food, for example, red meat and processed red meat, may have adverse health effects. Finally, as we explained with a bioaccumulation term, the animal-based food is the determinant factor of the dietary exposure for most of environmental toxicants. So these are the costs of consuming animal-based food. What are the benefits of consuming animal-based food? So obviously we have some nutritional value here. I mean, when we talk about fish, especially which ELMO advocates for, we have the omega-3 fatty acids, which are important for our health. And some nutritional value, obviously, some protein food also goes with the red meat and the dairy, yogurt, etc. Moreover, we have a high socio-cultural value at the consumption of plant-based, of animal-based food. I mean, you can think that most of countries with a very rich cultural inheritance, like I come from Greece, I'm just gonna say Greek, and of course all the other Mediterranean countries and North, we associate our food with our culture. So we cannot ignore that factor. And this is a very important aspect that ELMO takes under consideration. And then we also have economical value of our animal-based food industry. So it is a very big drive of our economy. And let's go now. I mean, after we considered all this, the risks and the benefits of consuming animal-based food and the benefits of consuming the plant-based food, we end up to the discussion about sustainable food systems. So this discussion had started the last maybe 5 years, but after the pandemic, I mean, after Corona era, it has spiked. The discussion about sustainable food system has spiked because the pandemic showed to us that our food system is not sustainable, and it's also a very big drive of the dangers we face as humanity, whether it comes as a zoonosis like pandemics or generally the loss of biodiversity. So United Nations and I mean European Union, of course, follows. They have already said that it's crucial for our future as humans to be able to move to sustainable food systems. And that's why the national dietary guidelines should align with sustainability goals. Next year, it's gonna be the first summit of United Nations, which is Food Systems Summit. It's the first of its kind. So we are gonna talk about it more in the future. And here I'm giving you two citations that I believe they are very good for somebody that has not heard of the subject to just start with them. So the first paper is written by Dernini et al., 2017 paper. It is on behalf of International Foundation of Mediterranean Diet. And it actually explains of the need for the Mediterranean diet to shift to a sustainability concept. So it does have a very interesting points according considering the fish consumption. And then we have another article which was published in 2019. It's the Eat Lancet Commission, actually from the Lancet journal. The authors are like maybe 30 or 40 people there. with first author, Wheeler Walter. It's the head of Harvard for nutrition and epidemiology. And it is a very, very good article to start if you want to get informed with this subject. And so now I just told you that our climate and our planet is very, very important for our exposure to toxic chemicals. So in one point of view, it does affect our long-term health. What most of the science now shows that it's not only the exposure to toxic chemicals, but it's so many other factors that affect human health, like the loss of biodiversity itself, with many ways that we have not even studied yet, can affect human health. So the leading research institution right now and United Nations, they have started talking about a shift to a new paradigm, a new health paradigm, which is the One Health concept. What is the One Health concept? This is a figure from University of Alaska, but you can find similar figures to all like United Nations and all these organizations, which shows that we cannot talk about human health if we exclude atmospheric sciences, for example. I mean, we cannot be healthy if we don't have clean air. We cannot be healthy if we don't have clean oceans. We cannot be healthy if we don't have healthy, sustainable fisheries. I mean, if the oceans biodiversity collapses, we collapse with them. So this is a new paradigm shift that we have to follow. And what I want to say is that lifestyle medicine is already a part of science that has already done a big step forward to see the bigger picture. So instead of just seeing our pharmacological way of treating disease and only seeing the genes, we have stepped back and we have started seeing the diet, the sleep, the stress, the social interactions as a part of our health. So this is why I believe that the lifestyle medicine healthcare professionals are maybe one of the ones that are more easy to realize the bigger picture that this figure shows, that we have to make sure that our healthcare, that whatever guidelines we provide to our patients, they are aligned with sustainability goals. And this is the final screenshot, final slide of mine from the Global Biodiversity Outlook 5, which was just issued now a few weeks ago in 2020. And it's a summary for policymakers signed from the United Nations. And it says that we need to go to a biodiversity inclusive One Health transition, which is managing ecosystems, including agricultural and urban ecosystems, as well as the use of wildlife, through an integrated approach to promote healthy ecosystems and healthy people. This transition recognizes the full range of linkages between biodiversity and all aspects of human health, and addresses the common drivers of biodiversity loss, decreased fish and ill health. So yeah, healthy future is in our hands, and that was my presentation.